which people will derive, and
Correct.
they do derive,
Yes.
and they can derive from any sport.
Yeah.
Running, swimming, cycling, playing a racket sport. So some movement, some sport is essential for all of us. If you follow that 80-20 rule,
Yes.
where your 80% of runs are at a heart rate, you are in zone 2 or 3, will protect you from injuries, and 20% runs should be in the faster clip. Everybody has a different HRV.
Correct.
There's no particular set of value that we should all aim for. Everybody has a different set of
It's individual.
HRV. I am not a big proponent of no pain, no gain.
Welcome to this special episode of the RunPlayGo podcast. I'm Shivani Singh, and our guest today is Dr. Jayant Arora, a renowned joint replacement surgeon with over 2 decades of experience. He's the director and head of unit at the Department of Joint Replacement and Orthopedics at Fortis Memorial Research Institute, Gurugram, and also leads the Gurugram Knee and Shoulder Clinic. Dr. Jayant Arora is trained in UK and has pioneered the use of advanced techniques in knee and shoulder surgeries, including robotic-assisted knee replacement and patient-specific instrumentation. He's also an avid runner and cyclist, bringing a personal understanding of sports injuries into his medical practice. What we can expect to learn today is how runners can prevent injuries, understand early warning signs, and approach recovery with the right medical insight. Deep dive into the science of running mechanics, common myths about injuries, and knowing when to see a specialist. Let's go. Welcome, Jen, to the RunPlayGo podcast, and thank you for being a part of this masterclass series that we are shooting with experts like yourself, giving us insights into injury prevention and so much more for the athletes like myself and so many more who are just starting out the journey in being able to understand the subject better.
Thank you, Shivani, for having me. I'm sure it will be a wonderful experience for me, and of course, I hope to contribute something to your listeners and your viewers.
So, as someone who works extensively with runners, endurance athletes, and people who are on various parts of that journey, what are some of the most common injuries that you see?
So, I think what has happened is that over years, especially when I moved to Gurugram, we in this city has a fantastic running community and overall a very good general sporting culture. And in my field of work, I was not only interested in joint replacement surgeries, which is what I've been passionate about.
Yeah.
But equally, I have been a player throughout my life.
Yes.
I took up running only, since after I turned 40, to be honest.
Correct.
Before that, I used to play any sport I could pick up my hands on. So I was seeing a lot of people with sports injuries, and then I started seeing more and more people with running injuries.
Correct.
And because I was a part of the program, I shifted my focus entirely from joint replacement surgeries more towards sports injuries, its treatments and its prevention.
Correct.
So now coming to your question, what kind of injuries do I see? I see all sorts of injuries, right from injuries to bones, ligaments, tendons, psychological impacts of injuries as well in players. So so there are different sports, different injuries. Runners have a different kind of an injury.
Correct.
Amateur people will have a different presentation.
Yes.
Pro people will have a different presentation, isn't it?
In fact, that was my next question. Are there some injuries which are more commonly seen in the beginners as compared to somebody who has been playing or running for some time?
Yes, absolutely. When somebody is beginning, sometimes they are overzealous. They just want to catch up on the time that they haven't utilized.
All of us have been there.
Yes, isn't it? And sometimes they are in a group which where the other members are much more trained and much more adapted to the sport or running, and they try to catch up and match up with them. So these are the things which can lead to injuries. Typically, it's muscle soreness, tiredness. Sometimes if they push through the pain, then they get more serious injuries as well. For a beginner, I would suggest take your own time, go slow, be steady.
Correct.
Showing up and doing some activity, not as vigorous, probably is the best way to get into a sport.
Absolutely, and gradual progression. From your clinical experience, Jayant, have you seen what is the most common underlying cause for these injuries happening? Overtraining, like you just said, or too much too soon, or is there some other physiological angle to it, or what really happens? Your body is not ready, and suddenly you are triggering the parts or muscles of your body which you probably have never used before. So what's the most common underlying cause here?
First of all, I would like to Of course, we're talking about injuries.
Yes.
That's what I see.
Yes.
But what I would really want to emphasize
Correct.
is the immense benefit.
Yes, of course.
Okay, which people will derive, and
Correct.
they do derive,
Yes.
and they can derive from any sport, running, swimming, cycling, playing a racket sport. So some movement, some sport is essential for all of us. Injury should not dissuade people from it, because the benefits are far more, far outreaching than any injury potentially put them under. And if you're sensible about it, chances of injuries become very minuscule.
Correct.
Very minuscule. So I think overall, participating in running sports is the way forward in life. Everybody should try it, no matter what your age, no matter if you have had an injury in the past. Still, I think you should, under supervision, be able to play some sort of a sport.
Yeah, absolutely. And human body is also very resilient. I go back into my own experience of a couple of injuries that I encountered, let's say 15 years back, and at that point it seemed like, I'll get limited in terms of the kind of sports I can play or endurance I can do. But today when I look back, it's 100% recovery, and it's as good as new.
Correct. That's the beauty of biology. That's the beauty of body. It heals up.
Absolutely.
And if injuries are picked up in time, we can probably stop them from getting too serious.
True.
And if, God forbid, you get an injury which needs some treatment, most of the injuries are treatable, and they will allow you to go back to play. In an amateur, in a person who is just starting, the best advice is to go slow.
Correct.
Get used to that particular activity. Don't do it every day. Give rest periods in between. So if you take up running, maybe 3 days in a week should be the ideal time, or maybe running a mileage which is sensible and not, you don't want to match up with a 100 kilometer miler, average person in a week. So you don't want to be there. So you start slow, you maintain it, and you would notice that your capacity, your endurance improves with every month.
Absolutely.
And that's how you prevent injuries.
Absolutely. You train your body
Yes.
physically and also mentally for the longer endurance game. So since I'm speaking to the expert here, what's the role of biomechanics in terms of both creating the injury as well as preventing the injury?
From biomechanical point of view, there are modifiable factors and there are non-modifiable factors.
Correct.
So the modifiable factors are in training. So the way somebody is, say, using a racket sport, for example, in badminton, I typically see people using a lot of wrist.
Correct.
To hit the shuttle, and that leads to injuries to their elbow, by the way, or using too much of shoulder force rather than their body momentum to play a shot, and then that leads to their shoulder injuries. So biomechanics is essentially more towards getting proper training from a proper coach, depending on different sports. Correct. So that's modifiable, and that will definitely, having a proper coaching for that particular sport is essential to prevent injuries from that particular sport.
Correct.
The non-modifiable part is that how your body is shaped. You can't change that.
Yes.
So, for example, in a runner, if you have bow legs, you may have a different set of injuries.
Yes.
If you have flat feet,
correct,
you might need a different type of a shoe. Or if you have extremely feet with big arches, then again you might need a different type of a shoe. You may have a different type of an injury.
Correct.
So those are non-modifiable factors. That's where a role of sports injury doctor can come in to guide a particular individual based on their shape and anatomical sort of variation, that what's the best way to protect yourself from those injuries.
Yes. In fact, this conversation came up with another expert that I spoke earlier as well, that we kind of schedule our health checkups in every other manner. But when it comes to some of these things, like for example, as a sports person, should I be scheduling my 6-monthly assessment with an expert such as yours to ensure that some of the things that you just spoke about are covered? In terms of, is my shoe the right fit for my kind of, situation of my legs, what's my joint health, what's my this, that, whatever. And especially, a lot of people are now starting late. Like you said, in their 40s, mid-40s, or even in 50s, people are probably getting on the road to run for the first time. So what role does going to the expert not for an injury, but from a prevention point of view? Yeah.
Everybody who is starting new, especially around 40 or so, or somebody who already has a pre-existing medical issue, hypertension, for example. If you see a diabetes mentioned on your blood profile, and that might spur people to get on and change their habits, which is fantastic. That's how it should happen. But before you start getting into high intensity activities,
Correct.
it is probably best to take an opinion from a doctor, not necessarily an orthopedic doctor,
Yes.
but mainly from evaluation of your other parameters, especially the heart.
Correct.
Especially if you're getting into high intensity.
It's like
sports.
getting a clearance.
Correct. That's
it's like
right.
getting a clearance.
That's right. A baseline cardiac work
Yeah.
should be done to make sure that your heart is good enough
Yeah.
to sustain significant high impact activities, which one can do in zeal and a spirit of camaraderie, competition, whatever you might want to call it. So yeah, so heart checkup as a preventive thing should be done.
Yeah.
From bone and joint point of view, not run through pain. Don't be driven by the dictum of no pain, no gain.
Yeah.
That may not always be the best dictum.
Yes.
Sometimes you would aggravate your injuries and then come back. Your body will give up entirely, and then you will just take much longer to recover. So if somebody is having a persistent pain, so all of us will get some discomfort after a strenuous workout in the gym or a strenuous badminton game or a long run. That's expected, but we equally do expect our body to recover in 48 hours, 72 hours at max. I don't suspect that somebody will keep on getting pain constantly in one place all the time. So if your pain is short lasting, goes away in 1 or 2 days, and next time you run or do anything strenuous, you might get some discomfort at some other part of the body. That's part of the course. That's normal. Yeah. But if you are in pain and that body is not recovering and that pain area is consistently located at one particular area, then you might want to come and see somebody.
Yeah, and maybe it's getting aggravated because,
or if you're seeing that the pain in that particular area is slowly getting worse and it's sort of coming in your way and you have to really grind yourself to push through the pain, then you might want to go and see somebody for that.
Being a part of the runners community, some of the words that we often pick up and through other athletes and also yourself are some of the common issues like IT bands is one thing which is commonly, everyone has encountered at some point. And then there are shin splints and things like that. So would you like to deconstruct what's happening at the biomechanical level on that and why those injuries are coming in and what is it that one could do to prevent those?
Yeah. In runners and cyclists, especially in runners, the ITB, iliotibial band, ITB, the full form is iliotibial band, which is essentially a long muscle from the outer part of our thigh, upper part of our thigh, all the way down to the knee. So it's a long ribbon-like muscle which moves forward and backwards with each step that we take. So
it's the connector.
Correct. Between your pelvis to the knee.
Right.
So that's a long muscle. And that muscle sometimes can get inflamed either in beginners or in long distance runners because of overuse.
Right.
And it can sometimes be very chronic in nature, troublesome also, stops people from running. The most common cause of ITB pain is not the ITB itself. It's essentially weakness of hip muscles or the glute muscles, if I may call it.
Right.
So if your glute muscles or hip muscles are weak, people will, or they tire out too soon, then people will strain their ITB muscles more to run.
Because that's taking the load.
Correct.
That's taking the extra load.
And that can predispose you on getting these injuries again and again.
Correct.
So if you want to get rid of a recurrent ITB problem, work on your glutes. Don't look at your ITB.
Correct.
Okay, that's my advice to a lot of the patients because that's one of the commonest things. And of course, regular stretches of your ITBs. Hamstring also is another big problem.
Yes.
If you have tight hamstrings and if you're not stretching them, then people get a lot of pain in front of their knee, around their patella, the kneecap. So that area becomes sore in people who have tight hamstrings.
Right.
So again, a very common problem. None of them is serious. It just stops you from running. Runners can develop serious injuries as well.
Right.
The most serious injuries that I see in runners is a stress fracture in the hip bone. And that needs surgery. Somebody is getting groin pain on running, that's a red sign. Don't let it linger too long. Stop and go and see somebody.
And what about shin splints? That's another, kind of sore area for a lot of people. This word keeps popping up.
Shin splint, if you see, is not as common in people who have been running for a while. It is much more common in beginners.
Correct.
Okay. And essentially shin splints happen due to two reasons. One is that when we are beginning to run, our bones are not used to the loading.
Taking that load.
Correct.
Yes.
So it adjusts, it takes a while to get used to that load. So in the beginning, using a proper cushioned footwear. So by using a more cushioned shoe, we reduce the impact on the bone. By reducing the mileage also, we reduce the impact on the bone. And making sure that you're not deficient in vitamin D or calcium. Your bone health should be adequate. So that also helps.
Of course.
And of course the exercises, the stretches.
Correct.
So all these things will take care of shin splints. It might stop you for a couple of weeks, 3-4 weeks, but generally it settles down. If your shin splint is persistent, and you are a pro runner, you have been running half marathons and marathons like nobody's business, then I would worry about the stress fracture, because then you might be overtraining and you might be labeled as a shin splint. Instead of having a shin splint, you might have a deeper injury, which is a crack in the bone. And that I've seen. One of my colleagues, who is a plastic surgeon, who he is a great runner. He came one day and said, my shin splint is not getting better. It has been 6 months. And I said, okay, you've been running on it? Yes. And when you do an MRI, we find, okay, there's a bone edema and there's a stress fracture.
Constant debate between the midfoot, front foot, heel, impact. So I was trying to change my stance a bit. I was feeling that there was a lot of heel strike that I was doing. So in the process of trying to move that to the front, I was doing a lot of mobility exercises, which changed my stance over a very short period of time. Let's say within a month, I was trying to push my body to lose its natural stance and move to a different stance. And then I suddenly realized that my shins were not in a good shape and there was a lot of pain which came in. So I think that was the impact issue that came in, because I was putting the impact in a different manner.
Different way.
And in a very short period of time.
Yeah. If somebody is doing endurance runs, long runs, then shin splints become a real trouble.
Correct.
Because if your footwear changes, the way you land changes, or you try to change that biomechanical part of it, then even if you're a pro runner, you can potentially develop it, because your body is getting loaded in a different way.
How significant are factors like pronation or your limb length discrepancies in the development of some of these?
The foot has a bigger arch.
Correct.
And and when you land more on the big toe side of the foot.
Right.
Supination word means that you tend to land on the lesser toe part of the
angle
foot.
Angle is different.
Correct.
In terms of your
so you are loading your foot differently. That's again inherent to everybody. You even if you want to change it, you may not be able to change it, because that's how subconsciously your body will land. The best way is to not change that and to try and find footwear which adapts to your body shape. Correct. Rather than you adapting to a footwear. Okay. I don't think from an amateur perspective, people who are not professional sports people, it doesn't really matter at all. There might be some variation in the footwear that you might want to try differently if you're a pronator versus a supinator. But generally speaking, people who have flattish arches, they become much more comfortable with shoes which have thick cushions in the arch, supporting the arch.
Correct.
People who have really high arches, and if they do get any pain, then calf stretches can prevent it without looking too much at the footwear.
In fact, last year when I was struggling with an injury and I had come to you, I remember you had suggested a change in the shoe, and actually that relieved me almost 70% of the issue that I was facing. And we had done a lot of detailed investigations around it. So before I came to you, I had gone through a series of various processes in terms of physiotherapy and other things that I had gone through, but it hadn't become better. But that one change in the shoe that I did after speaking to you actually worked.
So every problem will require a different intervention. It could be a physiotherapy, or it could be a footwear modification, or it could be a particular stretch. So it will depend on from injury to injury, or maybe sometimes even rest to begin with.
Correct, absolutely. You just need to give it a break sometimes. Your body is asking for it and we are pushing through. So you work with both elite and amateur athletes quite extensively. What daily habits do you recommend for prevention?
The best habit that I would think about prevention is to listen to your body. There are days when you are scheduled to sort of run a particular distance, and when you get up in the morning, you know that you're not there, or that you'll have to really push yourself through. So sometimes you should listen to your body, and that will prevent you from injuries. But I'm assuming here that you are a seasoned runner, and that you have figured out the kind of shoe that you'll be using for a 5K run versus a shoe which you will be using for your trainings versus a shoe that you will be using for your trail runs.
Tempos and trail runs.
So every run may have a different type of a footwear that you might want to use. So you have figured that bit out. You are good with your exercises. You know what stretches you need to do. And by the way, those stretches can change. There is no one set of stretches which will work for an individual. In fact, for the same individual, For first 3 months you might be working on your hamstring, which are tight, but then later on you might have to work more on your ITBs. So as a runner you need to also identify that which muscle area is sore and how to address that.
It also may depend on what kind of event you're training for, or what's your next goal, and therefore are you doing more hill runs, or are you doing more tempo runs, or are you doing more flat runs or trail runs or whatever.
Yes.
So different parts might be getting impacted because of that.
Yes.
So you have to then take care of that a little bit more than you were doing earlier.
Correct. And people who are seasoned runners, they tend to figure out, okay, this particular run, I'm putting more pressure on this particular part of my body.
Yeah.
So either I need to avoid that or I need to stretch it more.
So are there any non-negotiable warm-up or cool-down routines or stretches or any specific module that you may have in mind that you may want to share?
So I think one thing which is non-negotiable in my opinion is stretches.
Yeah.
You need to do it, especially after a long run. It has to be done, and they really help you. And stretches not only just after the run, but maybe many hours after it also once again is helpful. As long as you are stretching and you are listening to your body, I think that's probably it.
Some of the absolutely superlative runners I've seen and who've gone years without an injury are actually the people who train later in the evening. So if they've done a long run in the morning, so instead of stretching right after that, maybe they'll do a little bit of mobility at that time. But after that, towards the end of the day is when they get into their deep stretches.
Yes.
So that's another very unusual thing I've seen. But these are the people who've never gone into it.
But that's what is recommended, that you need to stretch it after a few hours after you have done the exercise. Also, you do it immediately after, and then you do it again. Maybe 8-10 hours later.
What kind of pivotal role strength training has, we all know as runners, and we also skip it as runners, most of us, because when you are building volume, for example, for a long event, then if you're running 4 to 5 days a week, then always there's something which gets compromised, and what gets compromised is always strength.
Correct.
So would you like to re-emphasize something?
I think I'm just sort of repeating it. It's already been written enough. I'm just going to emphasize it again, that especially for a runner, working on your thigh muscles, glute muscles especially, and your lower back muscles, your core muscles is so essential. It's not only essential for preventing you from injuries, but it's also essential to let you run better, faster, by the way. So I think strength training is one of the ways by which you can run faster. And the other thing is, which again as runners we all know, the 80-20 rule. To run fast, you need to run slow.
Yes.
You need to train slow, isn't it? So if somebody is training on fast runs all the time, then they are not letting their body metabolism to help them run faster when it really comes to that.
Yes.
So running at a heart rate which is slower is far more essential, and when you're running slower, you don't get into injuries.
Absolutely.
So if you follow that 80-20 rule, where your 80% of runs are at a heart rate where you are in zone 2 or 3, will protect you from injuries, and 20% runs should be in the faster clip.
There's a lot of overtraining that all of us end up doing. So in terms of that, is there a measure of knowing that I'm in that zone now, that are there some signs that your body is giving where you should say that it's a time to maybe take a little step back, or my body is asking for more recovery at this point in time? So apart from Garmin, which tells us that after every run it tells you it's 64 hours of recovery you have, but is there any other way of picking up from your body? So
I think Garmin data essentially is based on a parameter called heart rate variability, HRV. So everybody has a different HRV.
Correct.
There's no particular set of value that we should all aim for. Everybody has a different set of HRV.
Individual.
As a runner, you need to be aware what is your HRV. And if you are outside that zone, then you are not recovering. If your resting heart rate is higher, when you get up in the morning, your sleeping heart rate is higher, your HRV is too low, low, not high. If your HRV is too low, your resting heart rate is higher, your sleeping heart rate is higher, you need more recovery time. And if you're sore, you're still, painful muscle, sore muscle. So these are the sort of signs which are telling you that go slow, give it more time.
Talking about the more specific areas like our tendons and ligaments, so how do they adapt to our increasing load on training?
Even in an 80-year-old individual, our muscles will grow, by the way. That's the only organ in our body which tends to grow on stimulus no matter how old you are.
Correct.
Okay. So our muscles have this remarkable capability. And if we load them consistently, slowly and gradually build it up, they become stronger, collagen forms, ligaments become tougher. So and those are incremental gains which happen slowly and they don't go away suddenly. If you stop training, then maybe you will develop deconditioning of your heart a little bit faster, but your muscles still remain pretty well conditioned and they come back to same strength again when you reach
tissue repair happens.
I think but that's anyway, if you have big bulky muscles, strong ligaments, that protects you from falling due to old age and frailty. I'm talking about later ages, when you are 70, 75. So there's a lot of benefits of exercising with regards to that. And our muscles will keep on adapting. If somebody has started running and initially you might find that, okay, 5 kilometers looks too daunting, but the same person after 3 years might be running 15 without batting an eyelid.
Absolutely.
So this is how our body can adapt.
Absolutely. How do we know it's general soreness or it's something in which we need to then look into a little bit more deeply? It might be an actual injury. How do, from a medical perspective?
So somebody who has run can still have a pretty severe pain for 6-8 hours, 10 hours or maybe 12 hours after the run. They can feel very tight in their leg. That doesn't mean that they have injured themselves badly. It might be just that their muscles are into spasm. But if all that spasm disappears pretty much in 36 hours or 48 hours, that means there wasn't any bad injury and you're good. But if your pain is lingering on and you're limping and hobbling and not able to walk, then that might mean that it's a deeper injury. So I think duration of soreness or pain post the activity, how long it lasts will determine how significant an injury could be. Some soreness for 36-48 hours is expected. If it is lasting 2-3 days, 4 days and it's stopping you from weight bearing on the leg, maybe get yourself
So
checked.
let's say 2-3 days post your training run or any activity that you did that caused it is alright. But if it's still there after a week,
still pretty sore, then
and you're struggling to go back again to do that activity, then
something is more serious.
What's your advice on how a runner should respond when the pain first sets in? What are when should they self rehab? Should they just rest it? And I've actually myself also gone through it. When the injury set in, I thought that maybe just 1 week of rest. Then I thought, okay, 2 weeks of rest. And then I was doing the cold and hot compress and things like that. So I went through a cycle of doing this as well, which is I think very natural for a runner to think exactly what you said, that it's a small thing, body will self heal. But what's the time to come into the specialist like yourself?
For a seasoned runner who has been running for a few years, if they have a persistent pain which hasn't responded to rest, which hasn't responded to ice packs and maybe taking few days of painkillers and you are still sore, can't go back to run 2-3 weeks post that injury, then I think get yourself checked. That's a sign that your injury is taking much longer than normally it should. It might still heal up with time for all that matter. It might just need a longer period of rest because some injuries will take a little longer time. But generally most of the minor injuries should settle down in 2 to 3 weeks. If it is still lingering on,
and there is nothing like running through the pain, and pain will make you stronger, and
it's a good motivating factor. Because if you have pain and if you're running through it, I'm sure you have known many people who have been into health troubles because of that. And of course, due to my profession, I've ended up doing surgeries on people because of that. I am not a big proponent of no pain, no gain.
Thank you so much, Jayant.
Thank you.
And it was a pleasure to have you with us.
Same here.